Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What you need to know about quitting painkillers. The need to safely quit taking painkillers is growing as more people use drugs to treat chronic pain. A 2024 study based on more than 9 million patient charts across 10 years found the use of nonsteroidal anti-inflammatory medications, NSAIDs, opioids, and other pain medications has risen. These drugs are used to treat a wide range of conditions. /r/n/r/n In some cases, chronic pain requires the long-term use of painkillers. Other people may need to take them temporarily, but in all cases a healthcare provider needs to guide the process of changing a prescription, tapering a dose, or managing withdrawal if stopping altogether. /r/n/r/n This article explains what happens when you stop taking NSAID analgesics, such as ibuprofen, as well as other pain medications. It also covers how your healthcare provider can help monitor any withdrawal symptoms. /r/n/r/n Dependence and addiction are defined separately by the American Psychiatric Association. Physical symptoms of dependence can emerge when people take a medication for a long time, whether it's an NSAID, antidepressants to treat mental health conditions, or betablockers for heart and blood pressure. /r/n/r/n Addiction involves a loss of control, typically in ways that impact your life. It's generally implied that the medication is interfering with an individual's life in some way. There are several criteria for addiction, including tolerance or misuse of a drug, a painkiller dose that's too much or too often. /r/n/r/n Dependence on pain medication happens to nearly everyone who uses an opioid for a period of months or more. Yet just 8% or less of people taking long-term opioids will develop an addiction. With painkillers, it's possible to have dependence without addiction or even addiction without physical dependence. /r/n/r/n In 2022, opioids were one of the most commonly used drugs used to treat chronic pain. When you abruptly stop taking opioids, or narcotics, your body can go into withdrawal. Some common opioid withdrawal symptoms include /r/n/r/n Medications including methadone or naltrexone injection can help to prevent opioid use, while Lucemyra, lofexidine, is available to treat withdrawal symptoms. Talk to your healthcare provider about managing opioid withdrawal. /r/n/r/n NSAID medications, such as ibuprofen, are used to treat chronic pain about as often as opioids. It's available over the counter as well as prescription. /r/n/r/n It's typically uncommon to develop a dependence on NSAIDs, but studies have found more than 11% of ibuprofen users take more than the prescribed dosage and face the risk of becoming dependent on the drug. /r/n/r/n If you regularly take NSAIDs to control inflammation and swelling, you can expect it to return again. Increased swelling may increase your pain rnrn, which can have secondary withdrawal consequences. You may experience anxiety simply because new pain tends to have this effect. /r/n/r/n Some anticonvulsants, including Neurontin, gabapentin, and Lyrica, pregabalin, can be used to treat pain. In addition to similar withdrawal symptoms to those of opioids, there may be an additional risk of seizures. Other symptoms can include /r/n/r/n tricyclic antidepressants like amitriptyline, along with serotonin norepinephrine reuptake inhibitors, SNRIs, are among the drugs commonly used to treat certain types of chronic pain. They may have a milder withdrawal phase than opioids and anticonvulsants. /r/n/r/n The most common antidepressant withdrawal symptom is anxiety, which can cause increased heart rate, profuse sweating, and rapid breathing. You may also find your mood to be lower than normal during antidepressant withdrawal, though this is more common if you had mood difficulties prior to your treatment for chronic pain. /r/n/r/n. If you want to quit taking your pain medication, first contact your healthcare provider to talk about strategies for stopping your treatment, changing medications, or adjusting or tapering dosages. With chronic pain medications, it is crucial that a healthcare provider guide the process. Even with a slow weaning process, there may be the need to monitor or treat withdrawal symptoms. /r/n/r/n. On the other hand, it may be your provider who prefers a more cautious approach and recommends that you stop taking painkillers that you feel you have come to rely on. Good communication with your provider and pharmacist can help with the transition. /r/n/r/n. There are ways to safely quit taking painkillers, and it's important that you not stop taking them on your own. The medications, opioids, NSAIDs, antidepressants, each work differently, and you may experience withdrawal symptoms that need to be managed effectively. /r/n/r/n. Your healthcare provider can help to ensure that your chronic pain is treated while limiting the risk of painkiller withdrawal effects. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.